Hello everyone, so my name is Midwife Sally. Welcome back to my channel. On this channel we'll talk about pregnancy, labor and delivery, and make sure that you don't forget to subscribe. So subscribe to our channel, tell your friends about our channel as well. Today we are going to talk about why do pregnant women urinate frequently. So you can be pregnant and then you realize that you are urinating frequently and you are wondering, is it normal? What could be the problem? So today we are going to understand why you urinate frequently, especially in your third trimester. Okay, so getting to from the beginning of the pregnancy, because your pelvis, okay, so the uterus in the first trimester is a pelvic organ, okay, so it's a pelvic organ. It shares the same space with your bladder, and so once pregnancy starts, it starts competing for space with the bladder in the pelvis. And so you may realize that in the beginning of the first trimester, you have frequent urination, but it is not so much. Once you get into your second trimester, your uterus begins to grow and expands. Okay, as it expands, it comes up and becomes an abdominal organ. It is no more in the pelvis. It needs space to grow, so it comes into the abdomen and becomes an abdominal organ. Getting to the end of the pregnancy, within the third trimester, the uterus would have grown so big and also starts to exert another pressure again on the bladder, because the bladder is just beneath the uterus. And so once it's just beneath the uterus, what it does is that it's just like having a heavy load on another balloon or something else. And so, of course, it will not allow the bladder to expand fully. So it expands a little, and then you accumulate urine a little, and you feel like going to urinate because the pressure of the uterus is not allowing it to expand to its capacity. So within the shortest time, you'll be visiting the washroom more frequently, and it's all because of the pressure that the uterus is giving the bladder. And it is completely normal. There's nothing wrong with that. Okay? You should be able to differentiate that from when you have an infection during pregnancy. When you have an infection during pregnancy, you realize that the urine frequency can be so much. Although the bladder can exert pressure, this is excessive. So you frequent urination every minute, you feel like emptying urinating. So that is something that you need to note, okay? And sometimes you have painful urination, burning sensation during urination, a foul-smelling discharge. All this shows that there could be an infection. So you should be able to tell, but it is for a lot of pregnant women, we are not able to tell whether we are having an infection or it's just due to the pressure of the uterus, okay? So if you are confused and you don't know whether it is just the normal one, the right thing to do is to talk to your doctor, talk to your midwife, so that they would examine you, check for other signs, or even run an examination to check whether there's an infection involved, okay? But most often there's no infection involved. It is because of the pressure of the uterus on the bladder. Yes, so I hope you get the explanation and you will not be too worried about it anytime you see it. What you can do is to make sure that when you are going to sleep, you take less fluids and make sure that you are close to wherever you are going to urinate, so that the discomfort during sleep time can be something that you can manage or tolerate. Thank you. My name is Midwife Sally. Hope you understood it. Leave a comment below. Thank you. Bye.